Us now, Democratic Senator Chris Murphy of Connecticut. Senator Murphy, thanks so much for being on this morning. What will this package be able to do? I mean, the bottom line is vaccines are months away, and there are localities that still can't test.
Yeah, I mean, we've got some big problems, and those problems are caused by the fact that this administration didn't take this seriously enough. Back in early February, many of us were begging the administration to come to Congress, ask for an emergency supplemental request, understand that there was no way to avoid this epidemic hitting our shores, and they stood back and said that they had everything that they needed. And so we're a little bit behind the eight ball, but this is a significant amount of money. It's enough to get what we need down to local public health directors. That's really where the front lines are. It's enough to speed a vaccine as quickly as possible. The real question is tests. Why are we doing 500 tests this week in the United States when a place like Australia can do 10,000? That's just a matter of this administration not having planned early enough, and it's going to be a while. It's going to be a few weeks before we have the ability to actually test individuals who need it.
Hey, Senator, it's Willie Geist. You anticipated my next question. We were just talking to Mayor Bill de Blasio of New York, and his big frustration is not having those tests. On the air, he emphasized again, we need those tests. We need not tens, we need hundreds, maybe thousands of those that we can do every day. So will this package in some way help expedite that to get the testing kits to all these places that need them?
It will. But again, we're just, we're about a month behind. There's a report out yesterday suggesting that early on, when the FDA tried to go down to the CDC to work on testing protocols, they couldn't even get in the door. There's been just a lack of seriousness in this administration that is very, very worrying up until today. And so this will expedite the ability to get tests out there. And listen, I think it is important to say that the administration is not wrong, that today your risk is pretty low in the United States of contracting coronavirus, but that doesn't mean that we shouldn't know. And this money, if we get it approved in the Senate today, the president puts his signature on it, will help. But remember, the president asked for $1.5 billion. This is going to be $8.5 billion. And so if the president had gotten what he wanted, we wouldn't have the resources necessary to speed up the testing regime.
You've had access to people and information. So what's your suspicion, or what do you know about why this administration, as you say, move slowly on this? Why would it be in the president or anyone else's interest to have an outbreak of coronavirus?
Well, listen, I think you're dealing with an administration that just doesn't believe in the legitimacy of government to solve any problem. This is a Republican Party that over the years stands for one thing and one thing only, which is just the obliteration of the public sector. And so my sense in those early meetings was that the administration just sort of thought that states and local governments could handle this, that the federal government didn't really have an early role to play. And that just is not the case. The only way that you tackle epidemics like this is through national leadership. And I think it's a reminder for this administration and Republicans that there is reason to run government efficiently and well instead of attacking it and demoralizing public sector staff at every turn.
Senator, do you know anything about the classified briefing that was given to top congressional leaders about contingency planning in case coronavirus does impact Washington? Is there anything that you can tell us about plans for keeping Washington functioning if there is indeed a pandemic?
Well, listen, I think that right now our focus has to be taking steps to slow the spread of this disease. And so I can't share anything with you. I don't know actually that I was in that particular briefing. I think we all are taking the same steps. Be smart about washing your hands. Be smart about contact with other people. Get in touch with your physician if you start to feel symptoms. I don't think there's a lot different happening in Washington, D.C. That's my sense that's happening out there in every other city.
All right, Senator Chris Murphy, thank you very much for being on this morning.